Hello, hi, I'm Anurag reporting from Health in India. Greater Noida some years back got the most preferential investment destination, especially for real estate. However, something was missing, a good healthcare facility. Greater Noida, as per the 2011 census, has a population of just over a lakh of people, which are mainly corporates, industrial units, and service class, which are working in banks and other companies over here. Before 2003, most of the Greater Noida people were relying heavily on the healthcare facilities available in Noida or at most Delhi. There were some people who were even traveling up to Gurgaon to get good facilities. In 2003, Naveen Hospital came into foray with its hospital in sector Alpha 2. This was a time when healthcare scenario in Greater Noida started changing. Today I am accompanied with Dr. Anil Kumar, who is the medical superintendent at Naveen Hospital and also the head consultant at the ENT department. Good afternoon, sir.
Good afternoon.
You have been one of the pillars, if I say, who have been working with Naveen Hospital from the time of its inception in 2003. Initially, I know Greater Noida only started getting some good crowd maybe around 2008. But you started in 2003. Of course, there were a lot of trauma cases that were coming your way. But what were the challenges that you faced initially when you started Naveen Hospital?
The challenges which we faced during that time was the manpower. Because the Greater Noida is at a very distance from Delhi, so we are getting very difficulty getting the consultants and the nursing staff and the paramedicals. So anyway, but somehow we found out the consultants and the paramedical staffs, and we started this as a multi-specialty hospital, especially as a gynec department, pediatrics department and the trauma center. And we are the first hospital in Greater Noida who started ICU facility in Greater Noida. And all the consultants, because in some other hospital the consultants are coming from Noida, they are not staying in the Greater Noida, so 24 hours facility has not been available. So Naveen Hospital was the only hospital in 2003 who started its in-house facility, IPD, OPD, emergency facility in Greater Noida at Naveen Hospital. With all the doctors are staying in the periphery of 5 kilometers of the hospital. So they are easily and available to the patients in need of emergency.
I think Naveen Hospital is one of the few hospitals who have got so many empanelments with corporates, TPAs, all TPAs, and not only that, you have tie-ups with the schools and other institutions as well.
Yeah, that's true, because we have all the prestigious companies and corporates in our panel, and almost all schools we are covering. And we are providing comprehensive facility to all the sectors of this community.
Of course, we know Dr. Naveen Kumar is a very charismatic leader in himself, and working with him would have been a great experience for you all. You see the kind of figure that he is in the entire Uttar Pradesh, if I say, because I keep on seeing his articles in Dainik Jagran and all. So how was his leadership when Naveen Hospital started? Okay, you told me that there were a lot of challenges. So there must be a time when you would have been thinking that have we started a wrong project, or have we stepped on a wrong place or something like that?
No, it is definitely. Dr. Naveen has been to this place, last 30 years is practicing to this place. And moreover, all the villagers, they have a blind faith on Dr. Naveen. And definitely we got a very good rapport of the villagers when we started this hospital, because initially they came to this hospital and they are asking for Dr. Naveen, and if Dr. Naveen is not available, they used to go to Dadri. But slowly the faith of the villagers came on the doctors who has been appointed by Dr. Naveen himself.
When it started, it was at one time termed as a killer highway, killer expressway. So was that the fact that there used to be so many casualties? Because what I think is because of the lack of facilities, maybe with the trauma patient requires at least a stabilization after a hit. So since there were no such facilities available before 2003, of course after Naveen came, it came with complete ICU care and ambulance. So was this the reason that so many casualties were happening in Greater Noida? Because time taken to take the patient from Greater Noida to Noida or Delhi was of course quite vital for saving a life.
It's very true, because once this express highways were made, so the people, because of high speed trauma, we are getting a lot of high speed trauma, and you know, in this trauma, these first 2 hours are very crucial for the patients, because blood loss, oxygen saturation drops, and at that time, if you got a proper trauma unit and with the proper trauma consultant with you, you can save the life. Definitely, it gives a very important backup to the Greater Noida medical facilities when we started this Navin hospital here, and we have saved lots of life because of this. Because as soon as this trauma happens, this police and this locals, they bring the patient to Navin hospital, and we, with the competent team of trauma and the surgeons, anesthetists, we used to tackle these patients immediately, and we give the resuscitation, medical emergencies been provided to them, and we save many lives. The rest of the blood bank, in case of emergency, they ask for the donor. But Navin Hospital Blood Bank is the only blood bank where, in case of emergency, they don't ask for the donor, they provide the blood without the donor also. So definitely it helps us.
Navin Hospital has come long way from 2003 to 2013, and you have been associated from the hospital from the time of its inception. Now we have seen the hospital being revamped, facilities being just made state of the art with OTs, new modular OTs, CT scans and all. So what kind of, you would be able to give us more insight as to what all revamped facilities are going on?
Well, we started long back in 2003. We are just adding on the facility, because now the need for the different type of surgeries like knee replacement, hip replacements, which is not possible in Greater Noida earlier, because of now we are making the modular OT. So we can we can do these surgeries in Greater Noida at a cheaper rate, for which the patient has to travel to Delhi or to metro cities. But now these facilities, because of the modular OT and because of the computerized lab and CT scan, we have put that is a double slice CT scan, for which the patient has to travel to Noida or to the Delhi. Now the patient has to be in a Greater Noida. They can achieve all these things in the one
revamp of facilities. Are we looking at a price hike as well? Because Navin Hospital is always considered as something which is good services at very affordable prices. So are we looking at a price hike as well with the revamped facilities?
No, not at all. Because Navin Hospital is the name which gives the quality treatment at a very cheaper rates. So we are not going to increase or hike our prices, but we give the good facilities with a good ambience at Navin Hospital. I started my practice over here. There was no ENT surgeon, and all the ENT patient has to travel along to Delhi for the operative intervention. So I started all the microscopic surgeries like tympanoplasty, mastoid surgeries and stapes surgeries in Greater Noida with a very cheap rates. I started the package system for because the villagers are poor, they don't have money. So I started all these surgeries on the package basis. Then there is no endoscopic surgeries in Greater Noida. Even in Noida, some places they do this endoscopic surgery. So I started, I pioneered this endoscopies, nasal endoscopic surgeries like functional endoscopic sinus surgeries in the Greater Noida. Apart from this, I used to diagnose all this cancer, oral cancer patient at very early stages, so that we can give a better treatment to all these patients. And apart from this, I started the hearing clinic over there for the deaf and dumb childs. We started the hearing clinics, and we provide the hearing aids also. And we have a speech therapy clinic also regularly. Every Friday we had a speech therapy and the hearing clinic in our center. So as far as ENT is concerned, we do all types of surgery and all types of diagnostic procedures in Navin Hospital.
Okay. The cost that you told that they are always very cheap and very competitive. I won't say cheap, it's more affordable and very competitive. Now, since there are more corporate hospitals coming up, Navin Hospital is obviously known to expand now. as you told that there are a couple of more hospitals that are coming up, which will have much bigger and much larger scope of facilities. So the ENT facility that we are talking about is what kind of patients you generally get for ENT, and what is the number, the footfalls and all?
Usually what in routine practice what we are getting lots of patients of ear patients, the perforation in the drum, and we got a lot of polyp patients or sinusitis patients. So and moreover this as the Greater Noida, you know that it is surrounded by many villages, and the tobacco chewing, weed smoking and hookah smoking is very common in this area. So I am getting a lot of cancer patients also, oral cancer patients, laryngeal cancer patients. So the cancer patients are also, the incidence of the cancer patient in this area is very high. So the early diagnosis is very, very important in these cases, so that we can provide a better treatment plan for them. As you know that in the field of cancer we have progressed a lot. Like we have a multiple therapy like chemotherapies and the radiotherapy and the surgical intervention. So early detection of the cancer in these patients, in poor villages, we can save the life of these patients.
Dr. Anil has been very modest. In fact, he has experience of more than 16 years in the field of ENT surgery. He has been associated with some of the biggest hospitals that you name, Bombay Hospital, Batra Hospital, and he has done marvelous job, as he told. And it was really great of him to come to a city like Greater Noida, which has virtually no healthcare facility, and to start the entire India ENT department in Naveen Hospital. And today, the kind of surgeries that he is doing are available only at the corporate hospital and bigger hospitals in Delhi and Noida. Thank you, Dr. Anil, for your time. It was great talking to you, and we wish you all the best for all your future endeavors.
Thank you very much.
Thank you, sir.